Assalamualaikum and hi everyone. Today I want to talk to you about a topic that's affected us all in profound ways, COVID-19. This pandemic has been a defining event of our time, forcing us to adapt to a new reality and reminding us of the interconnectedness of our world. It's been a roller coaster of emotions from fear and uncertainty to hope and resilience. The main title that I'm going to talk about today is Cracking the Coronavirus Gender Mystery. It was a fascinating phenomenon that emerged amidst the chaos of the COVID-19 pandemic. The gender disparity in its severity. While both men and women were susceptible to the virus, the research revealed a curious pattern. Men were significantly more likely to experience severe illness, hospitalization, and even death. This disparity sparked a global scientific quest to understand the why behind it. Was it biological difference, a behavioral factor, or a complex interplay of both? Today, we will embark on a journey to unravel the mystery, exploring the latest research and its implication for the future. Our journey began with a vision to revolutionize the pharmaceutical landscape. This vision sparked a fire in the heart of Amirul, our founder, who has dedicated his life to the pursuit of healthcare innovation. With his entrepreneurial spirit and unwavering commitment to patient well-being, Amirul laid the groundwork of our company, inspiring a team of passionate individuals to join his vision. Kushairi and a brow furrow in concentration meticulously reviewed the latest research on COVID-19. As the lead pharmacist, he was committed to ensuring his team possessed the most up-to-date knowledge about the virus and its evolving nature. Fueling our scientific engine is Hakimi, our lead researcher, driven by a relentless curiosity and an insatiable thirst for knowledge. Hakimi leads a team of talented researchers in groundbreaking discovery. There are 6 agendas: the introduction, objective, details on COVID-19, COVID-19 infection, investigation results, and lastly, the conclusion. So, we're going to talk about the introduction, the COVID-19. COVID-19 pandemic has had a profound impact on global health, with millions of infections and fatalities worldwide. Interestingly, studies have shown that men appear to be more severely affected COVID-19 than women. This evidence in higher hospitalization rates, intensive care unit admissions, and mortality rates among men compared to women. This observation has sparked a global scientific inquiry to understand the underlying biological behavior and social factors that contribute to this gender disparity in COVID-19's outcome. While the Malaysian perspective, like Malaysia, like many other countries worldwide, has observed a similar trend of higher COVID-19 morbidity and mortality among men compared to women. Data from the Malaysian Ministry of Health indicate that men account for a significant proportion of COVID-19 hospitalization, ICU admission, and death. This raised the question of whether the observed gender disparity in COVID-19 outcome are consistent across the Malaysian context. And lastly, of the introduction is exploring the underlying mechanism. Understanding the reason behind the gender disparity in COVID-19 outcome requires a comprehensive investigation of various factors, including biological difference, biological patterns, and social determination of health. Alright, so I'm gonna say 3 objectives that I found based on the COVID-19 issue that we are responsible for researching about. Number 1, investigate the gender disparity in COVID-19 outcome in Malaysia. Number 2, investigate the relationship between testosterone level and susceptibility to COVID-19. And lastly, number 3, analyze the impact of behavioral factors on gender disparity in COVID-19 outcome. The first objective is research on gender disparity in COVID-19 outcome in Malaysia. The subpoint is lack of gender disparity and severity and gender difference in COVID-19 outcome. The second objective is investigate the relationship between testosterone levels and susceptibility to COVID-19. And the sub-point is again potential link between testosterone and COVID-19 and testosterone and immune function. And lastly, the third objective is research on behavioral factors and COVID-19's outcome. The first sub-point is gender difference in health behavior, and the second sub-point is social determination of health and COVID-19. So, I'm going to talk about the point, and Kimi, our lead researcher, are going to talk much more detail about the objective.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ahmad Kushari bin Muhammad, and I'm going to talk about details on COVID-19. So the first case detected, the first known case of COVID-19 are reported in Wuhan, China. The virus is initially unknown and referred to as pneumonia of unknown cases. World Health Organization, or very known as WHO, declares a public health emergency of international concern, or short form is PHEIC. The World Health Organization declares the outbreak a PHEIC, recognizing the global threat posed by the virus. The virus is identified as a novel coronavirus and named SARS-CoV-2. The disease is named COVID-19. In April 2020, the first wave of pandemic peaks in many countries, with hospitals overwhelmed with COVID-19 patients. Moving on to the next slide, there are COVID-19 infection. First of all, is the symptoms. The first symptom is fever or chills. Fever or chills is a very common symptom experienced by almost all individuals with COVID-19. Next is cough. A dry cough is another frequent symptom, ranging from mild to severe. Next is fatigue. Fatigue is feeling tired and exhausted. It's a common symptom even in mild cases. Next is muscle or body ache. Muscle or body ache is ache and pains throughout the body are commonly reported. Next is headache. Headache can range from mild to severe and are a common symptoms. And loss of taste or smell is an early symptom and can be persist for weeks or even months after recovery. Next is the prevention. The first prevention is get vaccinated or boosted. Getting vaccinated and boosted is the single most effective way to prevent COVID-19 infection, serious illness, hospitalization, and death. The second one is physical distancing. By distancing ourselves within 3 feet far can really break the COVID-19 chain. Next is hygiene. Hygiene as in washing your hands regularly to ensure that there is no virus will left in your skin or body. Next is mask wearing. Mask wearing is to ensure that we filter our air to ensure that there is no coronavirus that we will breathe in. And lastly is do test, as in do test regularly within 3 months once to ensure that we will stay healthy and away from COVID-19.
Hi, my name is Hakimi. Okay, so research on gender disparities in COVID-19 outcomes in Malaysia. Number 1, lack of gender disparity in severity. Study title is COVID-19 severity not linked to race, gender in Malaysia. Okay, the key findings is in Malaysia, unlike some other countries, data from 4,071 hospitalized patients show to significant difference in COVID-19 severity based on gender. The proportions of men with severe illness was almost identical to the proportion of men in the mild disease group. This suggests that both men and women experience similar level of COVID-19 severity in Malaysia. So the limitation is the study was conducted early in the pandemic and may not reflect the situation later on. It analyzed data from hospitalized patients potentially not representing the entire population. The study did not control for other factors that could influence severity like age, pre-existing condition. Okay, research on gender disparities in COVID-19 outcome in Malaysia. Number 2, gender differences in COVID-19 outcomes. The title of the study is UNFPA Malaysians COVID-19 Gender Analysis Report. This published on April 2020 and the authors is UNFPA Malaysia. So the key findings is women in Malaysia face increased vulnerability to domestic violence, unplanned pregnancy and maternal mortality during the pandemic. Women also experience disproportionate job loss and economic hardship due to COVID-19. The report focused on social and economic impact, not on disease severity. It does not provide quantitative data on the extent of gender disparities in each area. Investigating the relationship between testosterone levels and susceptibility to COVID-19. Number 1, potential link between testosterone and COVID-19. The title of the study is The Complex Interplay Between Serum Testosterone and the Clinical Cause of Coronavirus Disease 19 Pandemic, a systematic review of clinical and preclinical evidence. So this published on August 2021 and the authors is Aisilidis Kiki. So the key findings is the study found a complex interplay between testosterone level and COVID-19 outcomes. Lower testosterone level were associated with increased risk of severe COVID-19, include hospitalization and mortality. Testosterone may influence COVID-19 susceptibility by number 1, upregulating TMPRSS2, an enzyme that aids viral entry into cell, and 2, modulating the immune response, influencing both pro-inflammatory and anti-inflammatory pathway. Limitations. Most studies are observational, making it difficult to establish causality. Testosterone level can be influenced by various factors, making it challenging to isolate its specific role. More research is needed to understand the underlying mechanism and potential clinical implication. The second is testosterone and immune function. The title of the study is Testosterone and the Immune Response, a two-edged sword. This published in May 2014 and the authors is clean. The key findings is testosterone play a complex role in regulating the immune system. At moderate levels, testosterone can enhance immune function by stimulating T cell production and activation, increase antibody production, and enhancing phagocytic activity. However, high levels of testosterone can suppress the immune response, potentially increase susceptibility to infection. And the last one is the limitation. The study can focus on testosterone overall impact on the immune system, not specifically in the context of COVID-19. Further research is needed to understand the specific interaction between testosterone and the immune system in COVID-19 patients. Analyze the impact of behavioral factors on gender disparities in COVID-19 outcomes. Number 1. Gender differences in health behaviors. The title of the study is Gender Differences in Health Behavior and Their Implication for COVID-19 Outcomes. This published on June 2022. The key findings is the study found significant gender differences in specific health behaviors related to COVID-19 outcomes. Men were more likely than women to engage in risky behaviors such as smoking, alcohol consumptions, and physical inactivity. These behaviors were associated with higher COVID-19 severity and mortality. Women were more likely to engage in protective behaviors such as hand washing and mask wearing, which help lower their risk of infection and severe illness. Number 2. Social determinants of health and COVID-19 outcomes. The title of the study is The Impact of Social Determinants of Health on COVID-19 Outcomes, a systematic review. This published in May 2023. Key findings. The study found that social determinants of health such as income level, education, and access to healthcare significantly impact COVID-19 outcomes, were more likely to experience severe illness and deaths from COVID-19. This was attributed to various factors, including poor housing conditions, limited access to health, food, and transportation, and higher prevalence of underlying health conditions. The limitation is both studies are observational, making it difficult to establish causal relationships. Identifying specific behavioral factors and social determinants that influence COVID-19 outcomes can be complex due to interaction between various factors. Further research is needed to understand the mechanism by which these factors contribute to COVID-19 vulnerability and develop effective interventions to address them. So, the conclusion is gender differences appear to be influenced by both behavioral and biological factors, according to research on COVID-19 outcomes. Become of things like different immune response and lower testosterone levels. Men may be more biologically prone to more serious illness, but socio-economic and health inequalities frequently affect women, making them more susceptible to the severe COVID-19 pandemic. To guarantee equal health outcomes for all genders, it is imperative to address these gaps through focused interventions and public health initiatives. To identify the precise mechanism causing these discrepancies and create successful solution, more study is required. To customize interventions and advance fair health outcomes for all, it would be essential to look into the interplay between biological and behavioral components, as well as the effect of socioeconomic determinant of health of various populations.